So let me get into a little bit more detail on some of the bigger trends I think we all need to focus on. And the organization this morning just did a phenomenal job, so I won't go any deeper than this. But I think our view is, of course, is that the Reform Bill clearly changes the U.S. landscape. It's a fairly obvious statement. When you look at where the dollars are spent, obviously $946 billion on coverage. And as an American, I think we all should be proud of that. That's tremendous. With the resource-rich country that we are, I think that is an obligation, and it makes a lot of sense. A little help on the pharmacy side, and of course a little bit back to the providers, which down at the bottom quickly gets clawed back. And of course, in terms of paying for mandates and industry taxes are the source of those funds. And so I provided a lot of detail there for you. I won't go into it. I think we would characterize this deposit, if you will, on the very long journey to healthcare reform as a shift, certainly not a fix. I've heard phrases, now that healthcare reform is done. I don't think so. I think we've just begun. And again, I won't go through how chronologically these key elements of healthcare legislation transpire. I would say, though, that from our perspective, and I spend a lot of my time in D.C. and other capitals, we're going to up our presence in government relations on this one, because from the legislation to regulation, a lot will happen. And I think whether it's through the AHA or other organizations that represent you, I think our leadership challenge is to make sure that we're very well aware and engaged on how legislation progresses in this very important time. Of course, the big number on this page happens in 2014, the 32 million now insured patients into the system. Lots of debate on whether that's just a movement from the ED to the primary care physician. Also a debate on, do we have any chance at all at having the right primary care physician capacity to take on those 32 million entering at what we would all agree is a more traditional entry point into the healthcare system. I would say, though, I think one planning challenge for all of us as leaders is it is good news. There's more insured. I think there's a very real possibility, though, that we find a world out in 2014 where the best reimbursement we get for any patient is at Medicare level. And are we planning for that? Are we assuming that cost shifting will continue into this period of time? And as I come back to the employer role, I would argue that that avenue of managing that price pressure, if you will, is not going to be available to us. And so as leaders, we're going to be forced into the very stark reality of fairly substantial and dramatic efficiency challenges. Some would say, on average, that if the best rate you got for a patient was at Medicare levels, a 20% reduction in your operating expenses is what's required to manage in that world, just to maintain your current margins.